Today, we are excited to have guests Charity and Tom O'Reilly joining us to undercomplicate some information about ADHD. So, welcome to Undercomplicating Stuff, where we, two psychologists and coaches with over 40 years of combined experience, share our insights to help undercomplicate important topics. A friendly reminder that this video is meant for conversational and entertainment purposes only. Please see the information section of this video for additional resources. So I am Dr. Julie Radico. I am a psychologist, a coach, an author, and a speaker. And I'm here with Dr. Gideon.
Hi, I'm Stacey Gideon. I'm a health psychologist and the founder and CEO of a healthcare consulting and professional coaching business. And our guests, can you please introduce yourselves?
O'Reilly. I am an ADHD coach, and I approach my coaching from an internal family systems perspective. I bring a trauma-informed worldview, and I draw on my experience as a person with ADHD, living undiagnosed with ADHD for 30 years, trying to survive in tech, and then finally finding my way out of that hole. And now I'm coaching and passing on what I've learned.
And I'm Charity O'Reilly. I am a trauma therapist, and my experience with ADHD mostly is in being Tom's partner and being along with him for the ride of his diagnosis and beginning treatment and seeing him become an ADHD coach. And then we were asked to author this book about ADHD, which really actually started from a book that Dr. Radico and I wrote together, along with our colleague, Dr. Nicole Halverson. You Will Get Through This, a mental health toolkit. And one of the chapters that we wrote in that book, which is really a guide to undercomplicating mental health, which fits so well with the work that you two are doing. One of the chapters that we wrote in that book was about ADHD. And so Tom and I were asked to write a book as part of a series, the How to Understand and Deal With series, which of course, Dr. Radico is also writing a book as part of that series, which I'm sure she'll be talking about too. And so it was really just a very exciting journey for Tom and I, because he brings that lived experience as a person with ADHD, as well as the experience of an ADHD coach, and then I bring the lived experience of a partner with someone with ADHD. So it was a really exciting process for us to research and to write the book, which truly, I think, like most books, was a real labor of love to write.
What are some of the things that people get wrong about ADHD?
So, one of the most common things that I think people misunderstand about ADHD is what it looks like in real life, because we often have these images given to us through, popular media of like, oh, it's that kid who is like distracted by glittery things and like, oh, there's a squirrel, and they lose their focus. And often we think of it as a very hyperactive kind of thing, like the kid can't sit in their seat and things like that. What I'd want to bring awareness of is that there are many different presentations of ADHD, and the presentation that's probably more common actually is inattentive ADHD. And so you're not going to like be jumping out of your seat and absolutely restless, but maybe you can't focus and you have a hard time managing your time, and like maybe people think of you as spacey and things like that. So those are both ADHD, but one's an easier portrayal in the media of like the hyperactive, like it's entertaining, but I think it's a mistake if that's our only conception of what ADHD is.
I see with a lot of my female friends who have ADHD that they often don't realize until much later in life that they have ADHD. And that was Tom's experience as well. We know that women often don't present the same way with ADHD. And I think Tom is going to speak a little bit to some of the reasons why that is. Again, for my own friends, I've just seen over and over that they'll say, well, I can't possibly have ADHD because I don't present with these hyperactive symptoms, and they don't meet kind of what the social standard of ADHD is. But when they drill down into it and discover maybe why they're not functioning the way they hope to at work, or maybe why they're having difficulty in their relationships, they actually do have ADHD. It just is presented differently, and due to masking, can go hidden for a really long time.
Another common misconception about ADHD is that it's just a childhood disorder. It always shows up in childhood, even though it may not be recognized. But it is a condition that stays with you for your entire life. And so when we're younger, people with ADHD tend to express more of the hyperactive symptoms, but as we age and mature and our brains develop, our ADHD usually kind of evolves to be a more inattentive type. And or it can start as inattentive, but like that's the trend overall of like, as a population, people with ADHD tend to show more of the inattentive symptoms as they get older. And so as Charity was saying, women in particular, they're misdiagnosed or their diagnosis is missed when they're children because they are presenting as the inattentive type. It's not as obvious. And then once they reach adulthood and they start having adult responsibilities and they don't have the structure of like the school system to like keep them on track and keep them moving along, like they're responsible for their own decisions and their own executive functioning. That's when they often find for the first time that, oh, I can't meet the challenges and responsibilities. And it's often when parents and moms have kids that, they get them into the school system. Maybe the kids are getting diagnosed with ADHD and they learn more about it for themselves and kind of realize that it was something that they've lived with this whole time and haven't realized it. My passion is raising awareness of what ADHD actually looks like.
This idea of raising awareness, I think, is so important that you're both talking about and why this book is so needed. Even in my own practice, I have seen so many college age individuals, people in grad school, people in medical residency who are just figuring out that they might have ADHD, especially if they're so intelligent and they can figure out what you're trying to get them to answer on a test question or, doing just enough work to get by. It's harder when there's not that structure that you're talking about. When a teacher isn't going, okay, now class, we're going to do this for the next 30 minutes. Like college is just a free for all after you've lived in the structured world of grade school and high school. Like it is a regulate yourself. And that's so hard.
That makes me think of masking. Masking is when people who are neurodivergent, that could be people with ADHD or autism, it's they can put in extra effort to present to the world as like quote unquote normal. And truly there is no normal. There are certain expectations of people in our society, and we call those expectations and like neurotypical. And again, nothing's typical, but that's what we call it because that's the expectation. So people who are neurodivergent can present as neurotypical through a lot of personal effort, and that's what masking is. And so you mentioned, people who can be like high functioning for a lot of their lives, but what you don't see is the sacrifice and the amount of effort that it takes for them to show up in the world that way. And for a lot of people with ADHD, they spend all of their energy showing up as like a neurotypical and like a work or school setting to the detriment of their personal relationships, their personal health, and just their life satisfaction. And so they're kind of living life on the edge of burnout constantly, just kind of holding on white knuckle or the entire ride, which is a very challenging way to, get through life. And you miss out on so much by masking and not getting the support that you deserve.
Thank you for explaining the difference between neurodivergent and neurotypical, because I think a lot of people get those confused and don't quite understand them. So that was really helpful. I'm curious, given you and Charity being married, in what ways does ADHD impact relationships with families, not necessarily yours specifically, but in general, in what ways might it impact different relationships?
As someone who has been married to a person with ADHD for, it's almost our 10-year anniversary, so for about 10 years, it is, I think, so important for the loved ones of people with ADHD to understand ADHD, to undercomplicate it, as you all are doing for them, and as hopefully the book will do for them. Because as Tom mentioned early on, really there's a strong temptation in our society to label people with ADHD as underperforming or lazy, or I think what happens in relationships is as not caring. Because some traits of ADHD that show up in relationships are that the person might be very forgetful. They forget that they said that they would take out the trash or whatever it is. And so the other person in the relationship might feel like they don't really care. They're not really paying attention. And then with that inattentiveness, even in conversations, there's something that's been so helpful for me to understand, and we wrote about it in our book, which is something called the attention tunnel that people with ADHD enter into, and actually many neurodivergent people, not just people with ADHD, is that when they're focused on something, they really cannot think about something else at the same time. And so if I approach Tom when he's in the attention tunnel, maybe he's working, maybe he's doing a house project, I might feel like he's not really paying attention to me. So therefore, I interpret that to mean he doesn't really care. But learning about ADHD has helped me understand, oh no, he really does care just as much as I do. And to what he was just saying about the effort that it takes, it actually takes him much more effort than it takes me to focus on a conversation or to remember a task. And so I think for loved ones, they can get very frustrated. We can feel like that person doesn't care about us because they aren't remembering or engaging in the same way that we might be as a neurotypical person. And I'll just say that I consider myself a neurotypical person, and yet really understanding what it's like to live in their brain and how frustrating it is for them, I think brings us so much ability to have patience and grace and understanding.
Building upon that, like how would you all recommend somebody best support a loved one who has ADHD?
From my experience, I think what has been very helpful in our relationship is that our relationship is a shame-free space. So when I am struggling and I don't understand myself, I know that, it is still safe to just be myself. And to have a partner that understands that ADHD is not a moral failing, it is, a neurological condition. Understanding ADHD as a condition helps our communication a lot of understanding, like, yes, I'm in the attention tunnel. The other thing is that sometimes I don't have access to my own internal state very well. And so, I'm not responding to what Charity's saying, and I can't even explain why because my brain is so fuzzy. So I think the other thing that has helped with like being, shame-free communicating is allowing your ADHD partner time and space to kind of reconnect with their brains and their bodies in a way that they can actually articulate what's actually going on in there.
There's obviously no perfect person in any relationship. So for Tom, it happens to be neurodivergence and ADHD, but I often share with him, I'm a person with chronic illness. And so in the same ways that I, have to be patient with Tom's brain, he has to be patient with my body because I might not be able to keep up with him on a hike in the same way or even just keep up with his energy level in the same way. And so no matter your relationship, if it's a romantic relationship, if it's a parent-child relationship, it's a friendship, no one in that relationship is perfect. Everyone has their struggle. And just looking at ADHD as, okay, this is that particular person's struggle that I need to be patient with. How are they being patient with me in the ways that I maybe can't quite keep up with them?
Sounds like communication is key and understanding and patience and grace. Are there other things that you really suggest people focus on? And maybe it's more highlights in your book that can help them with even a child who's having ADHD, parent that maybe wasn't diagnosed until later in life, if at all.
Well, something we talk a lot in the book is treatment options for ADHD. And ADHD is a condition that your treatment options will be pretty limited for if you don't receive a formal diagnosis for ADHD. So it's not impossible, but without a diagnosis, you just won't have as many options. Because ADHD is something that's happening in your brain, medication can be a very helpful thing for dealing with ADHD. And you cannot receive medication for ADHD without a diagnosis of ADHD. And I think Tom would certainly share about and can, if it's helpful, how medication has been helpful on his journey with ADHD. The other thing that you can't really do without an ADHD diagnosis is if you need accommodations in your workplace or in your academic life if you're a child or someone in college. So without a formal diagnosis, it can be pretty impossible to get accommodations, and yet accommodations can be incredibly helpful. So what do I mean when I say accommodations? For example, and again, this is something Tom can speak more to personally, but an accommodation that he ended up taking was he originally worked full-time in his tech job, which he will share wouldn't have been possible without an ADHD diagnosis and medication, that is really what allowed him to work full-time in that job, but eventually realized that actually it was important for him to have a flexible schedule at work. And that's an accommodation he was able to ask for and receive, and is an accommodation that's helpful for lots of neurodiverse people that without a diagnosis, you really probably won't have access to. However, I also think it's important to note that not everyone has access to a diagnosis, and sometimes people don't want a diagnosis. Perhaps that's something they don't want in their medical history or be connected to. And so in the neurodivergent community, it's considered absolutely appropriate to have what's called a self-diagnosis, which is you, perhaps through listening to something like this or through reading our book, you observe about yourself, I believe that I'm neurodivergent and I think I probably have ADHD. And so that's totally acceptable as well for you to notice for yourself. I think I have ADHD, and what are the strategies and skills that I can bring into my life apart from medication and apart from formal accommodations. And those we talk about a lot in our book. In fact, our book is almost exclusively focused on, there's only one section that's about professional support. The rest of it is focused on things that you can do at home on your own. So whichever path a person needs to pursue, if they want medication and they want formal treatment and they need or want accommodations in their school or workplace, so they go through a formal diagnosis, or if that's not accessible to them or even something that they're interested in and they go a self-diagnosis, understanding, as Tom was talking about, understanding how ADHD impacts you is so key for being able to say, okay, my brain is different and I do operate differently in this world that was not built for my neurodiverse brain. And so what are some of the strategies that I can do that are different?
I'm mindful that there are barriers that we can talk about related to ADHD. I'm also curious if you could share a bit about the strengths that somebody with ADHD might bring to their lives, their loved ones, their work.
There's some interesting academic research about whether people who are diagnosed as ADHD score higher on the creativity scales. Research is still kind of early, but I think intuitively there does to make some sense to me. Of a lot of ADHD people are like spacey in their own little worlds, but like it's a very creative place in there sometimes. And so I wouldn't be shocked that there is some kind of correlation. And obviously there are many creative non-ADHD people, but I, it'll be interesting to see what it says about, trends in a population. A lot of things that are called strengths are also like features that like maybe annoy you sometimes. And it just depends on the context. So, that really willful child that's always getting out of their seat, like that willfulness is actually very helpful when they're an adult, of like they have, that constitution to persevere with these struggles. That hyperactivity can be boundless energy as an adult. People with ADHD can have trouble regulating their emotions. It's part of the executive functioning. Sometimes that leads to something that's called like justice sensitivity of when something is wrong and there's injustice in the world. Sometimes it's people with ADHD who get like the most passionate about doing something about it. And like with so many of our human traits, like there are strengths and there are challenges, and sometimes it just depends on the context to bring out the strength.
I would love to tell an adorable story about this. I have a friend who literally yesterday took her child to an ADHD evaluation. And this friend has ADHD, and she's fairly certain that her child has ADHD. And they were seeing their family doctor as the first step in the evaluation. And so the doctor did some initial things. And of course, they would end up referring on to a psychologist if they do decide to get a formal diagnosis. But this was their first step. And for some reason, the doctor just decided to do an entire physical. Sexual violence prevention work, we educate children about body safety and their body belonging to them. And clearly this child had had that education because this little child who, really shows a lot of those ADHD symptoms, like Tom was talking about, talking a lot, getting out of her chair a lot, being very hyperactive. When the doctor said, and now I'm going to check your private area, she said, no, you will not. And everybody agreed, okay, that does not need to happen. We're just actually here as a first step for an ADHD evaluation. There's no reason that we need to check her private area. And her mom was so proud of her and group texted a bunch of us that she said no and stood up for herself. So, sometimes the very kiddos that people are identifying in school as having issues or problems actually have just so much resilience and so much strength and so much creativity and spontaneity and stubbornness that is going to serve them really well in their whole
I
life.
hear a lot of assertiveness and empowerment in that little girl in your story. Thank you for sharing that. Do you think the prevalence of ADHD is increasing or that we're just more aware of it?
We don't know that the prevalence of ADHD is actually increasing. Certainly, the diagnosis is becoming more common, but that doesn't mean that ADHD as a condition is more common than it used to be. And there's a lot of reason to believe that actually, no, it's probably the same. A lot of ADHD has a biological basis. So if I have ADHD, there's a strong likelihood that my one of my parents had ADHD. There's a lot of genetic studies of like twin studies, and they say it's like between 70 or 80% of your predisposition comes from your genetics. So if our genetics are not changing dramatically over, the past 100 years, then what is changing? Yes, it is definitely the awareness piece that is increasing. And I think that's kind of backed up by what we mentioned earlier of, a lot of boys are diagnosed in childhood, and then a lot of, females are diagnosed in adulthood. So it seems like there were quite a few children missed in the past. There is a theory that it seems more common because as society changes, people with ADHD symptoms are becoming more obvious. There's a theory out there that ADHD people have what's called hunter brain. So humans started as like a hunter-gatherer society, and people with ADHD were probably the best hunters. We're sensitive to stimuli. We're curious, impulsive. We want to go explore the world, and like those are features of a successful hunter. But if you're a gatherer, you want to be organized. You want to be able to delay gratification. You want to sow seeds and harvest months later. Yeah, and you have to do all this like planning. And so as we've kind of evolved, like from there, we evolved into an agricultural society. So the gatherer brain became like more preferred in a way. And then we became an industrial society. And now we're in a technology society. And in each step of society's evolution, it gets harder and harder for people with the hunter brain to kind of navigate the world that's designed for the gatherer brain. And so that's kind of how I think about neurodiversity versus neurotypicality. Like ADHD is so common that it had to have had some kind of evolutionary benefit in the past, but it's also not common enough that it's like the dominant best thing for everyone to have in the way that society has evolved. The prevalence is increasing because society is changing and we're becoming more aware, but it's not necessarily because like our genetics are changing.
Thank you. I really liked that description of the hunter and the gatherer, and it makes so much sense when you explain it that way, that theory. What do you think when people say, well, I have adult ADHD?
I think the accepted consensus is that your symptoms of ADHD are like a lifetime condition. There are other conditions that have a lot of overlapping symptoms with ADHD, but if it's what we understand as ADHD today, it's going to have symptoms that show up in childhood. So even though you're being diagnosed as an adult, the clinician or the assessor will look at your childhood experiences to kind of help inform their diagnosis.
A pretty big time that we might see ADHD show up in adulthood that could cause somebody to think, oh, I've developed ADHD is actually perimenopause and menopause. When due to hormone changes, people may not be able to focus as well as they once did. Their energy may be more scattered than it once was. They probably aren't sleeping as well as they used to, which can lead to some cognitive issues. And so things that are actually perhaps due to perimenopause or menopause might be completely unrelated to ADHD, but somebody might misdiagnose at that time as having ADHD, or the opposite, they may discover their ADHD for the first time because those symptoms have been exacerbated by the perimenopause or menopause, and they are unable to mask them in the way that they once were. And while we're speaking to it, there are some other pretty common mental health conditions that are confused with ADHD, and the one that I see all the time, every week, because I'm a trauma specialist, is PTSD and ADHD. And the PTSD symptoms, actually both extremes of the biphasic nature of PTSD, hypervigilance and dissociation, really can look like ADHD. Hypervigilance can look like, of course, hyperactivity, and dissociation can actually look like inattention. And so that can be really, really tricky to parse out the diagnosis for. If somebody is dissociating a lot, they may look like they're inattentive and be misdiagnosed as having ADHD, or vice versa. And if somebody is very hypervigilant and on guard all the time and kind of constantly checking their surroundings and checking to make sure that they're safe, they could be misdiagnosed as having hyperactivity. quickly. And so it's really important to parse through those two things. And, the good news about PTSD treatment is that PTSD is one of the few conditions that can be treated through to completion where people no longer meet the diagnostic criteria for PTSD. So I often encourage people, go ahead and get your PTSD treatment, because if that treatment is successful and you no longer qualify as having PTSD, you're not constantly hypervigilant or constantly dissociative, then it will be easier to tell if you have ADHD.
As we're talking about this, I am curious for each of you to share what is one of your favorite or go-to or recommended strategies for managing a symptom of ADHD?
I think that's a great question. And before I answer it and tell you what like my favorite strategies are, I just want to frame the context of the strategies that work for me aren't necessarily going to work for everyone else with ADHD. In our book, we have like a huge list of different options that you can try as strategies, and sometimes they're contradictory. And so part of managing ADHD is finding what works for you. And so what works for me may not work for you, and it may not even work for me 5 months from now. Managing ADHD is a moving target. And what happens is the ADHD brain needs novelty, but we also benefit from routine because, with routines, that means we have less decisions to make and less things to remember. But that's in tension with our need for novelty, which helps our brain to function. It gives us the dopamine that we need to help our brain make the connections. My strategy is to pick up as many strategies as you can. And so that way you have a deep toolbox of when you're struggling to like meet your obligations and struggling to get your brain functioning, just have a good toolbox that you can reach into to see what works for your brain at that moment.
I will say, after writing this book and coming across so many amazing strategies from research, from lived experience of people, there are a million ways that people can discover, as Tom was saying, that they can explore to help them deal with their ADHD. But this one, my favorite one, I think does come from my experience as a trauma therapist. So somebody who's always thinking about the nervous system and how we can regulate the nervous system. And that is the coping strategy of co-regulation. So not everyone knows what co-regulation is. It does come from polyvagal theory from a scientific perspective, and it's really just the idea that our nervous systems as humans regulate each other's nervous systems, which is why if you're around somebody who's very stressed out and is maybe panicking, you are going to start to feel very stressed out too, because your nervous system is picking up their nervous system's cues. And if you're around somebody who's very calm and centered, you're going to start to feel more calm and centered as well. But where this helps with ADHD is that people with ADHD perform better when they're co-regulating with another person. And that can look like a lot of different ways. So Tom might come to me, and this happens often, and he'll say, I'm working on this project. Can we co-regulate? So we'll just be in the same room working together. But if I'm busy and he can't do that, he'll go to a coffee shop to work to co-regulate. And there was actually a pretty long period of time where he was using something that's available to everyone. And so if you think, well, I don't have anybody that I could co-regulate with, there are numerous websites and apps that will help you do this. And the one that Tom would use is called Focus Mate. And you actually would have a number of free sessions every month that you could use, where with somebody all around the world, 24 hours a day, you could connect with someone on Zoom and co-regulate. And so you would say, here's the task I'm working on. And they would say the task they're working on, and then there would be a timer set as part of the app. You would both work on your task together, and then when that timer went off, you would report back. Co-regulating at a coffee shop, at a library, outside on a park on a nice day is also a really helpful way for people with ADHD to cope.
And I just want to circle back to maybe my most important coping strategy, which is medication. And so, there's a couple of perspectives I want to take on this. First, I want to acknowledge that, sometimes individuals who are diagnosed as children and are put on medication early, sometimes they have a different feeling towards medication than I do as someone who is diagnosed as an adult. Like sometimes they internalize the idea that like they can't function without medicine. I think whether you choose medicine or not should be your choice 100%. But as someone who, grew up unmedicated for 30, well, I didn't get diagnosed until I was 30. So I'm not sure like when I had like really a medication that worked well for me. I'm not sure when exactly that happened, but it was pretty late for me. And I struggled a lot. And so I think I want to address people who are resistant to a diagnosis because they think that getting medication is some kind of failure. And it's really not. So we talk about ADHD as a disability sometimes. And a disability doesn't mean that there's something wrong with you. It just means that there is a mismatch between what you're capable of and what society expects from you. So if I was to use an analogy of like a person in a wheelchair, there's nothing wrong with using a wheelchair. The problem is often that we live in a society where our buildings are inaccessible. But if we made our buildings accessible, people in a wheelchair could participate in civic life as fully as anyone else. So that's the kind of understanding to bring of disability. It's more a diagnosis of a cultural mismatch in terms of like supporting all the diversity of people that live on this planet. And so let me talk about my own medication journey to just kind of give you a picture of what it could look like. Because it's made a big difference for me. And so I just want to share my story. Before I was diagnosed, I studied psychology. I went to law school. Then I waited tables for like 5 years. So like I was bouncing all over the place because I couldn't find a place where like I could perform consistently and like always do well. The one exception being waiting tables. Being a person with ADHD waiting tables, like that was a great fit for me. And it was a great job. And I would have like I'd be happy if I had to do that for the rest of my life. But I also did have other passions that I wasn't able to explore because of my ADHD. So I was very interested in like education and technology. So once I got my diagnosis, I started, my first medication. It's like, oh, you know what? I think I could actually do something like teaching. I started studying to become a math teacher. And on the side, like I'd been programming. One thing led to another, and I actually ended up working for a tech company. And again, that's something that I could not have managed without medication. And it was something that I dreamed about all my life of like, I want to work in tech. I just don't know how to get there. And finally, door opened up for me. And I could walk through that door because I had the capability to work in an office like setting for 40 hours to get stuff done. Not saying that I did 40 hours well. That's a whole nother conversation, but I could manage, I could get by. It took a lot of effort for my ADHD brain to work that long, but medication can open up possibilities. Like I'm not a different person than I was before I was medicated. It really is just about it's another tool in my toolbox. And for me, it's been a very helpful one.
I really appreciate you sharing that, Tom. I think so many people will find that beneficial and relatable. As we get closer to wrapping up, I'm curious what each of you might share as a key takeaway that you would want people who are listening to this to carry with them from today.
I would want people to know that they have autonomy about how they approach their own ADHD. And whether it's getting a diagnosis or embracing a self-diagnosis, choosing to be medicated or unmedicated, and choosing to identify as ADHD or not, like that's always your decision. And so, yeah, that's my key takeaway is that you are in control.
I'm actually going to toot Tom's horn for a minute because I think a great takeaway for people with ADHD, whether or not they're formally diagnosed, is to participate in ADHD coaching. I saw how effective it was for Tom, and now he gets to provide ADHD coaching for others. And I think it's really transformative. It's very accessible to people because coaching can cross state lines and country lines, and it can be done online. And so whether you reach out to Tom or to another ADHD coach, I think finding somebody who does not judge or shame you in any way gives you that shame-free space that Tom was talking about, the co-regulation that I was talking about, and then really helps you explore all of the options that are available to you as a person with ADHD so that you can live the life that you want to live. I think coaching is an amazing way to do that.
We're so thankful to both of you for sharing your time today and your expertise, as well as letting us peek inside your personal lives a little bit. One thing I would like to know, if you could remind us again of the name of your book, when it's available, and how we get it.
Thank you so much for asking. The book is called How to Understand and Deal with ADHD. It will be published this summer of 2026, and you can go ahead and pre-order right now. So if you Google the name How to Understand and Deal with ADHD, it is the top result. It will come right up. It lists both of our names as the authors. And while you're there, do not forget to also pre-order Dr. Radico's book, which is How to Understand and Deal with Anger.
If this topic resonated with you, please share it with somebody that you care about. Also, please comment, like, and subscribe. You can listen to our podcast on YouTube, Spotify, or Apple. You can also message us on YouTube, Facebook, or LinkedIn with suggestions of questions you'd like us to discuss in future episodes.